Assalamu alaikum, this is Parveen Mir from Psychometric Solutions, and I am speaking to you from the beautiful island of Mauritius. I have the honor and pleasure of introducing to you Dr. Hussein Rassool, renowned psychologist, and we have the opportunity to discuss with him regarding his upcoming book that he has regarding Jinn possession, magic, and evil eye. As psychology is both my passion and my major, I was very intrigued by his work, and in the last few years I myself has been researching on evil eye, Jinn possession, and magic. Now let's talk with the doctor and see what he has to say about this very much needed topic. Dr. Rassool, can you tell us a little bit about your professional journey?
Okay, أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم وعلى آله وصحبه ومن استنى بسنة يوم الدين قال رب اشرح لي صدري ويسر لي أمري السلام عليكم ورحمة الله وبركاته. Alhamdulillah, I have been very fortunate and going through my life journey, my professional journey from the island of Mauritius to traveling to many countries and working in many countries, and from the UK to Brazil to Hong Kong and many other places. Now, currently I am Dean of the Faculty of Liberal Arts and Sciences at the Islamic Online University and also Professor of Islamic Psychology. My previous background, I've been working in London. I work at the medical school, St. John Medical School, in the Department of Psychological Medicine. And, I've basically, most of my specialty, my previous specialty was on addiction and mental health. And the last few years that I have been interested in trying to Islamicization of knowledge in the sense of putting mental health and issues related to spiritual problems. And that's how, in fact, the book of Evil Eye, Jinn Possession, Mental Issues came about.
Okay. So what prompted you, what was your interest in this topic? What prompted you to write the book?
Well, I have a private practice, and I sort of developed over the years my own particular paradigm of what I call Islamic counseling. And 2016, I wrote a book on Islamic counseling, looking at the different school of counseling from sort of what I call Judeo-Christian counseling, and look at how these the nature, the process, the methodology, the approaches. Are they compatible with Islamic values and beliefs? Are they compatible with Aqidah? And so from that on, also have lots of patients who come to me, and I know globally as well that most Muslim patients that come sometimes, they don't have problem with jinn or evil eye, but they have problem with mental health. Nevertheless, there are a number of people, significant number of people who have problem with either evil eye or jinn possession. In fact, in clinical practice, you don't get patient with evil eye. You get mostly patients with jinn possession and evil eye. So what prompted me is trying to look at mental health issues in a way and look at the spiritual aspect of intervention. But what's important is if we try to have what they call psychiatrization of spiritual problem, which means we are putting spiritual problem into the labeling of psychiatry in the realm of mental health, And here there's always conflict because between religion and psychiatry, there's always been that conflict. Rather than an approach. But again, I must admit that the last few years, there's been a number of research which look at religion and mental health very much so, or religion and spirituality, and how spirituality can improve the outcome, health outcome, physical, psychological, psychological state of patients as well.
Okay, and do you feel our community lacks proper understanding of evil eye, jinn, and magic?
Definitely, because no, I mean, on top of that, there's problem with stigma, but that's another issue. So initially, yeah, people do, because they have difficulty. First of all, they don't know the deen, which is the problem. Now, again, I'm generalizing there. And also, they don't know how to protect themselves.
Mm-hmm.
On the other hand, there's a mixture, there's a sort of, they get confused between what is depression and what's problem to do with, what I call possession syndrome.
And how would one figure out the difference between the two? What would you
Very difficult, very complex.
Yeah.
The only way you can do it, because the signs and symptoms of many of the disorders from jinn or evil eye or magic or possession syndrome are very much similar to some of the disorders, either neurotic disorders or even some psychotic disorders like delusion and so forth. So, but however, the only way you can do it is through your ruqya.
Mm-hmm.
This is the only way. It's only through ruqya that which incantation they call it or something, that people can, that one can diagnose these syndrome.
Mm-hmm. What advice can you give to our Muslim counselors performing therapy that can implement a little bit more the Islamic counseling techniques?
I think, first of all, we all train. I was trained in sort of Western method of psychology. In fact, I was very much into humanistic and existential. And when I was having the course, I had a Jungian therapist as well. So it was quite a mixture. And then I realized afterwards that, okay, we're using like Prophet Malik Badri, who I consider to be the father of modern Islamic psychology. He mentioned that we are going out as psychologists, well, I don't see myself as a psychologist, but as psychologists going to the lizard hole. Because there's a hadith saying that if the Christian and Jews, do something, we're trying to follow them, or imitate them blindly anyway. So that's what basically is about. We don't take the Muslim context, the Islamic context, the Aqidah, the belief, the practice into account when we look at patients. We need to take this into account. We cannot apply, psychoanalysis with patients, although there are some things in psychoanalysis itself, in terms of dream, which is used by Prophet Muhammad Sallallahu Alaihi Wasallam. But that's another thing. But there are many of the therapy we use, so we are taking this straight away from Western Judeo-Christian values and belief system and trying to apply it to our Muslim patient. So what I would suggest is, first of all, you need to have a knowledge of Islamic science. What I mean by that, you need to have knowledge of Aqidah, knowledge of faith a little bit, you need to knowledge of Sirah, and that would help you in understanding your Muslim kind. Again, most Muslim kind come with you with somatic symptoms anyway, although they have psychological problems. So I think you can be a Muslim, you can be a Muslim counselor, but doesn't mean you're an Islamic counselor. I think the difference between those two, because you could be a counselor just because you're Muslim, but it doesn't mean that you're an Islamic counselor. An Islamic counselor, in my definition, although I tend to be very narrow about it, is that you have to use all your resources are based on the Quran and Sunnah, with technique based on not only Western, but also if you look at the life of Prophet Muhammad Sallallahu Alaihi Wasallam, he used a lot of psychological technique in dealing with people.
That's right.
So that's why I'm saying, we go back to the Quran and Sunnah and we can't go wrong.
Yes. Okay, and then can you tell us a little bit about your book and some of the exciting parts of the book?
Right. The book, inshallah, is going to be published in a few months by Routledge in London, and it's 25 chapters. It covers some sort of background, because I look at the initial background and context. I look at Muslim, who are the Muslim, because these books are not for Muslims. These are books for non-Muslims. So you have to write to an audience where, if they don't know about Muslim, they have a knowledge about Muslim. So look at Muslim globally. Look at mental health problem Muslim, because again, this is very difficult, because there are very few epidemiological data in some of the Islamic countries. Some of them, some data are collected, but they are very, very few. So it's very difficult to obtain, accurate or some sort of data on epidemiology in most countries. So you have that. I look at bioethics because it's important to look at mental health, and also the bioethics. We look at the social and cultural factors that affecting Muslim on a global scale, And then afterwards we move into the evil eye, the Jinn possession, the possession syndrome, the OCD, obsessive compulsive disorder, OCD, and also wash al-kari, which means what we call sometimes OCD. People have problems with purification; they wash too much, or they have problem with belief, or they have problem with belief, with ritual. We also with prayers, with ibadah, and also I have another sort of typology which I call the fear of losing control, which is a combination of all these three different conditions.
If you can tell us one thing that our Muslim brothers and sisters can take away about how to protect themselves from such evil, what can you point out?
Yeah, it's simple, because if you follow what is stated in both Quran and Sunnah, you find that there's protection there, because if after each prayer, of each salat, you do the trickle, Allahu Akbar, cross the Nas, cross the Falak, and also Ayatul Kursi, and that protect you. You do that in every prayer, after every prayer, and also before you go into bed, which is recommended by Prophet Muhammad Sallallahu Alaihi Wasallam, that if you do that, then you get protection. When you leave your house, you get protected. When you go, that is for women, they go to the bathroom, you have to make it work. So if all day long we like somebody said, our tongue is wet with zikr, which means that we always, whatever time we always protect. But by protection, it's the only way. This is the only way you can do it. It's not part of having the problem, then decide what you're going to do next. So these are simple. This is what Prophet Muhammad ﷺ suggested and has recommended us. So we follow him. He's our role model. So we follow him, and inshallah, Allah will. And also have tawakkul Allah as well. You have protection in Allah.
Is there anything else you'd like to share with us today?
I mean, I would encourage people to do psychology as a subject, but again, once you've done your basic degree in psychology, try to gain knowledge of the Quran and Sunnah, and try to blend it with it and develop. Muslims, we should be consumer of knowledge. We should be reproaching. We should go back to the golden age of Islam, where we produce a lot of knowledge. In fact, nowadays we need to how to Islamicize knowledge, and also we need to produce knowledge rather than being a consumer knowledge. So I hope that's
Jazakallah khair for your time and for hosting us here in your home. Inshallah, Dr. Rassool's book will be out in August, and please look for it. And I will be hearing from me as well very soon. Assalamu alaikum.